Welcome back. This is Neuroradiology Physics Part 2 with the focus on MRI artifacts. I'm Dr. Mike Hoch. Let's get started with the multiple choice questions similar to what you would see in the boards. So number one, easy question. Most of you have seen this before. What is the cause of the artifact in this teenage patient? There's a large signal void in the face region. This is susceptibility artifact caused by dental braces or metal artifact. You notice the hyperintensity around the margin of the signal void. Question 2, what is the cause of the pseudo lesion in T12 depicted by the arrow? Well, as you can see at T12, there's hyperintensity, which is in line with hyperintensity of the fat in the post-contrast image at T12 and at the S1-2 region, and that's poor fat saturation on the post-contrast fat-saturated image. Usually see this at the margins of the image, and you notice on the STIR and accompanying T1 weighted images without contrast that there's no lesion there. Question 3, what is the name of this MRI artifact? This is an Ant Mini. This is the zipper artifact caused by extra signal entering the MRI suite, whether it's through a defect in the Faraday cage or the MRI suite door remained open. And it often looks like what I think a candy cane sometimes. Number 4 is a two-parter, MRA neck images from the same patient in this case, and which image is the 2D time of flight MRA? Well, that's the option on the right, option B, and you can tell because the 2D time of flight has less field of view compared to the 3D time of flight, which is option A, and you can see this artifact on the 2D time of flight images because these images are acquired in slices as opposed to a slab for the 3D time of flight. And the second part is, well, what is the name of this artifact, of this slice artifact on the 2D time of flight MRA? Well, staircase. Don't be fooled by the stepladder. Staircase artifact. Patient moves during each one of the successive slices. It gives you this artifact. Question 5, what is the name of this MRI artifact? Well, you can see that the face is superimposed posterior to the occiput. This is answer E, which includes wraparound and aliasing. Same thing with different names. The way you correct this artifact is to increase your field of view. Question 6, another two-part question. What is this diagnosis of this suprasellar lesion? It's a post-contrast image, so it would have to be something enhancing. And you can see there's an artifact running through the image as well, which gives it away. And it's an aneurysm. The arrows depict that artifact, and what is the name of this artifact? Pulsation artifact caused by the aneurysm, which is pulsation, which is a type of ghosting artifact. Number 7, what is the name of this MRI artifact? You can see there's a very fine repeating pattern of lines through the image. Looks like a herringbone pattern of fabric. It's called spike artifact, and this is due to electromagnetic spike from poor gradients or fluctuating AC current breakdown of the coils in the MRI scanner, and it results in a bad data point in K-space, and you get the resultant image. Number 8, I think this one's a three-part question. You know the boards like to lock you in with the 2- and 3-part questions. So what is the MRI artifact seen here with the arrows? And you can see there's a midline lesion with a fat fluid level. This is chemical shift artifact. These are spin echo images, so it's probably chemical shift type 1. What is the most likely diagnosis for this lesion with chemical shift artifact? Well, it's a dermoid cyst. It's midline, extraaxial. It has the fat fluid level with the signal dropout, the band of signal dropout between the fat and the fluid. Type 1 chemical shift artifact. This occurs because the resonant frequencies of fat and fluid are slightly different. And then part 3, which technique was done on the T2 image to reduce that chemical shift artifact, to get rid of that band of the dermoid cyst? Fat suppression. It's the same image, just that the fat is suppressed. The scalp is dark now. All the fat in the scalp is dark, and the fatty component of the dermoid is now dark. All right, moving on. Number 9. What is the name of this MRI artifact depicted by the arrow? And you can see that the axial slices, where they are in the sagittal images of the red and blue planes, if you were to superimpose those, they would overlap and result in the signal void. And this is crosstalk. So two overlapping or neighboring slices that are excited and the signal crosses out in an area. This is called crosstalk. You can get rid of crosstalk by different angulation of the axial stacks, or you could do a bigger slice gap between your acquisitions, or you could also do interleaved acquisitions. Number 10, what is the name of this MRI artifact? Kind of looks like a zebra, or some people call it looking through like a screen door. It's moire fringes due to a lack of perfect homogeneity of the magnetic field from one side of the body to the other, and it has an interference pattern acquired usually on gradient echo imaging using the body coil. Number 11, I think this is a two-part question. What is the name of this artifact depicted by the arrows? Well, you see this fatty conus lesion, terminal lipoma, and on the T2 weighted image you see that on the anterior aspect of the lipoma there's a black outline, and on the posterior aspect there's a hyper-intense outline, and that's chemical shift type 1. You see that artifact at the interface between fat and fluid, just like the dermoid case. Part 2, all the following is true with chemical shift type 1 artifact except commonly called India ink artifact. That is associated with type 2. All the other options, A, B, and C, are true of type 1 spin echo chemical shift artifact. Number 12, what is the name of the core artifact in the sagittal image? Again, the orange box is depicted by the slice on the sagittal image, and you can see in the cord there's alternating signal. Within the cord it looks like there's like a pseudo-syrinx, but on the axial image it looks perfectly normal. And this is called option E, both A and B, Gibbs and truncation artifact. This is due to undersampling of K space, and you can correct this by increasing your matrix, or same thing, increasing the number of phase encoding steps. Question 13, part 1, what is the most likely diagnosis? We have this fatty lesion, pericallosal, with fat suppression on the T2 fat suppressed image and low signal on the gradient echo image. It's a lipoma, pericallosal lipoma. Part 2, so why lipoma is dark on GRE? Well, it's from chemical shift type 2, not blooming artifact. That's associated with cavernous malformations. Chemical shift type 2 is gradient echo images. Remember, type 1 is spin echo images. And on type 2, this occurs when a voxel contains roughly equal parts of fat and water, and the signal cancels out. Alright, that's the end. Good luck on the boards, and don't forget to review part 1 CT Physics if you haven't already.